welcome to episode 2 of Philanami Foundation. From a previous episode, we spoke about Dr. Nhleko spoke more about transmission of this disease. Kuthi uyithole emoyeni, uyayithola anyhow, and she unpacked a lot on how does it affect the lungs and all. But doctor, now, how does one see? Kuthi ngathi ngine-TB. What are the symptoms?
Okay. So remember we spoke about ukuthi le bacteria lena ye-TB, you inhale it and then it goes into your lungs. So usually abantu abaningi bane-TB of the lungs. So TB of the lungs umuntu uyibona ngani? So we talk about a cough. So if you've got a cough lengapheli, so yakudokotela ukunetha ama-antibiotics and it's not getting better, it might be TB. So we usually say a cough that's more than 2 weeks. But if you are someone who's living with HIV, we say a cough of any duration. So even if ngabe sekuthiwa ukhofe for 3 days, if you are HIV positive and you are coughing, you must get tested for TB. Ibuye bese ihambiselana with weight loss. Obviously, I go to your gym. Among a gym and you're losing weight, you don't want that. So yeah, ihambiselana with weight loss and what we call drenching night sweats. So look juluka ebusuku kumele uzushintsha amashidi. I look juluka ukuthi it's hot because you know it can get very hot on some days. As well as ukukhathala nokushisa. So this is usually now when you have disease of the lungs. But remember I said it can also spread through the blood system. So may spread through the blood system, then depending on ukuthi ifike yahlala kuphi, you'll have symptoms lapho. So sometimes it's if ifike yahlala in your brain, you could now have headaches. Yes, you'll still have lokujuluka, you lose weight, but now so ninkinga yama headaches, awusakhona ukubuka ama lights, what we call photophobia. So when you're looking at a light, iba too bright, and your neck iba very stiff. So it means now the TB has involved your brain. And then uthola ukuthi mhlambe it will sit kwama lymph nodes. Mehlala kwama lymph nodes, so yabona ukuthi ama glands or ama lymph nodes sikubita imbilapha in Zulu. I'm not sure ukuthi what. Yes. So lembilapha iyavuvukala. So now this is what we call TB of the lymph nodes. If ihlala in the bones, it can now cause TB of the bones. So lama joints akho abebuhlungu, avuvukale. So just depending on where the TB has settled, you'll have symptoms lapho kuleyo ndawo. But particularly important is the weight loss, the fever, and the night sweats.
For someone that's okay, I do have the night sweats, but the 1 minute I feel cold, 1 minute I feel hot. Is that one of the signs?
Yes.
Okay.
So that's a fever. So lokshisa nango, yeah.
Okay, doctor, you have unpacked the symptoms, but uqala nini ke umuntu ubona lama symptoms e-TB?
Okay. Earlier we spoke about TB being a silent killer, and I'm going to get into that just now, but the short answer is it can take up to 12 months after umuntu exposed to the bacteria. It can take up to 12 months. For some people, it can take years. And the reason for that is when you inhale the bacteria, may figure like lama lungs akho. For a healthy person with a strong immune system, le immune system yakhe yakhona ukuyicontaina le bacteria ukuthi ihleli in your lungs and I multiply, ayikhuli, ilo esikubita nge-latent infection in medical terms. But now the problem then becomes once immune system yakho yaba compromised or yadropha for whatever reason, then the immune system yakho ayisakhona ukuyicontaina le TB, ibese siyayirelease into the body and then ila seyiqala ukumultiply khona. So a lot of us are walking around with TB infection, sinayo TB, mara ayisigulisi, because your immune system is still able to contain it. But should anything happen that will result in the immune system yakho ibe compromised, then your immune system is no longer able to contain it, and then that's when now le TB kalukugulisa. So that's why it can take It can take up to 12 months. For some people, it can even take years before they get sick.
And then for someone to fortunate so testile TB positive, recently I have family, what must they do?
Okay. So remember, we said TB is an infectious disease and it spreads emoyeni. So just by you talking or breathing or coughing, we are expel lama bacteria bese abe in the air. So it's very important once we are diagnosed to disclose to the people that are close to you. Your friends, the people that you live with at home, your colleagues that you are close to. And the reason for that, it's very important to test for TB. And bear in mind, just because you are the first person that's diagnosed doesn't necessarily mean uwena otelele everyone. It's possible lomuntu lona who had TB initially just hasn't been diagnosed as yet, and you are the first person to be diagnosed. So it's very important more diagnosed. We want to now find everyone around you who might have the disease, because if when you are taking treatment but who's not on treatment, they can reinfect you, and then sobona ngawe ungalulami and you're not getting better on treatment, but it's because there's someone at home who has the disease, they're not on treatment, and they keep reinfecting you.
Doctor, ubalile ma symptoms how does one should see they might have TB? But then what must I do as a person if I'm sweating, all of that is happening, I'm coughing and I feel tired and all of that you've mentioned, then what must I do? How do I get tested?
Okay. So fortunately, TB testing is available gona wonke ama public healthcare facilities too, free of charge. So if you go to your nearest clinic, they are able to test you for TB. If you have the money or you have medical aid, doctors, even in the private sector, are able to test you for TB. So, masasik test for TB, how do we do that? If ukona sniga is kwehlela, then we'll ask you to cough, and then we will test le skhohlela sakho for TB. But there are other ways that we can test for TB. We can use chest x-rays. We can even check for TB using a test yomchamo that will help detect TB if you're unable to cough. But there are multiple ways that we can use test for TB. Besides someone who has symptoms of TB or zizwa egula, there are also patients that we test even if they don't have symptoms. So for example, if ekaya guna someone who's been diagnosed with TB, balekile ukuthi nawe you should go and get tested for TB. So whether you feel sick or not, you will be tested for TB free of charge. If you are living with HIV and you've just been diagnosed, you will be tested for TB, and you'll be tested every year thereafter. Also someone who's had TB before. So if you've had TB in the last 2 years, because kulo 2 years amathuba ukuthi le TB ibuye are quite high. So in the first 2 years after uqedile TB treatment yakho, siyakutesta every year whether you have symptoms or not.
Yini le yenda ukuthi TB ngahle ibuye while you're on that?
Okay.
In the 2 years.
So one of the reasons could be ukuthi when utreatwa waqeda le treatment ngente ukuthi akhona lama bacteria lawa amancane asale behind, and then once was stop le treatment, you feeling well, yes, once was stop le treatment kudlule a bit of time, your immune system gets compromised, then lama bacteria aqale phansi a multiply bese le TB siyabuya. The other reason could be ukuthi lokade ngichaza earlier on to say someone at home could have TB. So let's say we're unfortunate, we diagnose you and say you have TB, we put you on treatment, you take your treatment properly, ube well, but someone ekhaya who didn't go for testing and as a result didn't get treatment, abese seyaku infect again. then you get sick again. So that also happens. So that's why it's very important, especially in the household, if someone has been diagnosed, everyone should be tested for TB so that we ensure if bekhona labanye who have TB in the household, but they also get treatment.
What happens if there's small children, immune system yabo ayikho as strong as ours, and now fortunately it has been tested TB positive kunebantwana endlini, maybe from which age to what age, what should happen?
Okay, so now everyone in the household, so before sasiya isibuke abantwana who are under age 5, okay, if there's someone who's a child in the household and they're under the age of 5, then we test them for TB and then we give them what we call TB preventative therapy. But now anyone in the household, regardless of their age, regardless of gender, regardless of the HIV status, anyone who's exposed to someone who's been diagnosed with TB is tested for TB. And if they exclude the TB or we've discovered TB aunayo, we are able to give you what we call TB preventative therapy. So TB preventative therapy pilisi that are also used to treat TB, but now we are giving them to you for the purposes of treating the infection. Uyakhumbula ukuthi sikhulume ngokuthi yakhona ukuthi le TB ifike ihlale inga multiply. So lama pills lawa esiwabiza nge-TPT treata le infection le ukuthi iclearishe, so that should your immune system become compromised, then you won't develop disease because we would have cleared the infection or killed the bacteria in your lungs.
That's the end of our episode 2. Thank you so much for tuning in. Let's meet again on episode 3. Philanami, your health is your wealth.